My name is Lila Precious Tolo. I'm one of the co-initiators and also the project manager of the Help a Mother and Newborn in Liberia project.
In Liberia, the lack of adequate medication and qualified staff at health facilities is one of the most daunting maternal health challenges faced by women in the rural parts. According to UNICEF, Liberia has one of the highest maternal mortality rates in the world, with approximately 1,072 maternal deaths for every 1,000 births. In the remote areas, infrastructure and facilities in clinics are often lacking. Midwives and health workers have to deliver babies without any electricity at night. That's how many children under 5 die every year in Liberia. They lose their lives to easily preventable diseases such as neonatal causes, malaria, pneumonia, diarrhea, and measles. And the most vulnerable are newborn babies. At least a third of all under 5 mortality occurs in the first month of life, and 1 out of every 10 women dies while pregnant, giving birth to their babies, or in the aftermath of delivery. Even though the country struggles to help boost its fragile health system through donors' aid and support, still, not every child stands a chance to survive. Addressing these challenges is critical, especially with the lack of adequate and qualified health workers, medications, and logistical support. Yet, the project Help a Mother and Newborn in Liberia is working against the odds to change the narratives.
So this project seeks to address some of the many challenges faced in reducing maternal and newborn deaths in Liberia. The target areas is Margibi County. We're working in 10 facilities in Margibi County. We're working in the 4 districts, but we're working in both schools and health facilities, because there are so many reasons why maternal death is an issue in Liberia, coming down from students making wrong decisions about their reproductive health, towards the facility not having the equipment and drugs and the necessary knowledge to provide quality care. So this is why we're working with students from 10 high schools. We are establishing Maternal Club. No, that's a sexual and reproductive health club. We're also working with the facility to establish Maternal Club. Not only that, we provided training for the staff of the facility, and we provided training for traditional midwives. One thing people do not know, or one of the people that are not supported in this maternal health issue, is traditional midwives, and they play key roles. They are the ones in the community talking to the women. They are the ones the women trust. And these women do delivery at home, which is not safe. In order to stop that, you have to bring them closer, support them, and provide them with working tools, because they are not being paid. If you say bring the child to the facility or the woman to the facility to give birth, and you're not getting anything, no one wants to do that. So we're working with a traditional midwife. We provided them training and awareness on why it's important to bring the women to the facility, and we also provided them with working tools to be able to do their work good. So there are a lot of factors that prompted us, not me only, my colleague and I, to start the initiative. So from community level to hospital level, you see women die so many days for reasons that are preventable. Sometimes it's because the facility lack of particular drugs, or that facility staff do not have adequate knowledge, so they have to refer that woman to another facility. And because the referral pathway is not straight, you notice that on the road or before the woman reaches the facility, she died. So every day, women die due to preventable causes. So when my colleague and I had the opportunity to go for a study visit in Switzerland, we decided to focus on maternal health issues and compare Liberia and Switzerland's system. And we notice that we are far behind. Like the maternal rate is very hard in Liberia. Totally have less than 1 maternal death every year. Sometimes they have 0 maternal death the whole country. But Liberia, we are above the international standard. The standard is every 100,000 live births, you should have less than 70 persons dying. But in Liberia, you have over 500 persons dying in every 100,000 live births every year. And these deaths can be prevented. So instead of sitting and saying, okay, we're waiting on the government or we're waiting on this person to do this, I like the quote from Barack Obama that says, we are the change we seek. Instead of waiting on some other person to do what we can do, we have to take the mantle and make a change.
Always love to unveil. We don't want to say, okay, this is this thing. Probably you go look in the cartoon and then you do not see what. So we have here 2 delivery kits. We hope that, so this is our main course so that women can deliver safely. This is what delivery kits up on our agenda. We have ambu bag. We have Jiwa and glove. We have cutting, we have gauze, we have ORS, we have umbilical cord clamp. We have thermometer. We have the manual and the electronic thermometer. We have different syringes. We have ORS, we have paracetamol. And yes, we have the urine test. We have pulse oximeter. And we have contraceptives and vitamin K.
Okay, you want it, you get it there. You not get it. You not coming every time they schedule you come. And you get a treatment, you go back, you get a treatment, you go back. And they won't help you can't get one that you will get it there.
Gamani, many come away. If I don't know, you shape a lot. You can pop back at the no, that we are dead next month, the 7 young uncle, they are on the 7 Ipa, Yapa, pretty. Young, you didn't want to put the Gabamuya, no, on the 7 more Ipa. Yaga get it, Yan Mountain Back Capella, Jen the Capapala, Capum and Back Capa there, only 4 people there now, Jana can say Mountain and Mayana Pana, the video, and Boy, not the Buna now.
The challenges to provide adequate maternal health services are enormous. The lack of commonly used drugs and materials can be seen in almost every health center within the 4 health districts of Margibi County. One ORC told us, this is the first time we are receiving such drugs and materials in this facility. As you can clearly see, are lacking.
Okay, my name is Benes Johnson, officer in charge for this facility, our own clinic. We offer services like OPD services, we do reproductive health here. We also offer the SAM program, which is we provide feeding for malnourished children in this facility, and we work from 8 o'clock up to 4 o'clock, and offer escort services for pregnant women for doing labor. It's a challenge when it comes to maternal health, especially the distances people travel to come to seek care at this facility. Pregnant women, they complain every day, and at times we even have home delivery doing the road while coming at the facility. Like yesterday, we just had delivery right along the road while the pregnant women were coming at the facility. So it's a challenge at the facility when it comes to maternal health. When it comes to maternal health, we have huge number of pregnant women coming to seek care, children under 5 coming to seek care, come for vaccine and other things. There are many. Yes, many at times, especially when it comes to our pregnant women who have those challenges. the pregnant women come to the hospital 2-3 times. They don't receive the requisite medication. They have to go on the TTM talking to them about coming by. They say, well, the people will go in, no medicine every day, asking us to go there. So at times they shy away or to deliver. At times, in fact, some of them even deliver in the community because of that. So the issue of medication at the facility is a huge challenge. Yeah, that umbilical claim is the first time for us to have that particular material to use during delivery. The umbilical claim, I have learned about it, but to see it, we only use the cord, the umbilical cord, but we are not using the claim. So I was like very excited today to see that this group help mother and newborn, providing it for the facility today for us to be using it is a good news for us. Right now, the chain of command, the medicine comes directly from the central medicine store to the facility. We imagine since October we got a supply of drugs. We haven't getting any supply up to today. So it's a challenge. If you bring 2 cups of paracetamol, if you receive over 500 person, just imagine that if paracetamol may not last up to that time, just for example. So the drugs they will bring is supposed to be quarterly. But just imagine we're going 2 quarters from October to March, it's almost like 2 quarters. We have not received additional drugs, so we are like, we feel drugs were brought, we are already going short. This donation has a significant impact to this health facility because those things like, we imagine we are not being weighing child, the newborn. We were all a weighing scale for newborn. We just estimate if the child is born, we estimate either this 2.5, 3.5 or 3.0, but this time with the donation we got a scale that will be weighing our newborn, which is a very good thing for us. We are all excited today for this donation. Yes, another thing that this group is doing for us that will also help our pregnant women to come to hospital is working with the TTM in the community. TTM will also encourage our pregnant women to come. Once you are working with the TTM at the community level will be able to encourage all pregnant women at their community to come to the facility. Is a good thing that the group also doing, and I must appreciate them for that. And we pray that this donation should not be only for today. We will use it for the internal purpose whenever maybe if we need, based on their report that we will give. It should also continue to help us with more supply of those materials.
Help for a mother and newborn is not only providing resources and logistics, but also working to achieve its 5 major objectives of the project throughout its lifetime. Agnes Nangwe is the S and RH Club coordinator. She explains what it was also important to establish health clubs for young adolescents in school.
Okay, so my role at Help a Mother and Newborn in Liberia is basically to work along with the big brother in Mangibi County, providing maternal kits, awareness, encouraging them to visit the hospital often for checkup to avoid infant and maternal mortality. We have been facing more challenges, like for example, you find big brothers in the rural areas refusing to visit the facility to do checkup because they don't have baby mom, they don't have the baby kits, the baby bag, they don't have transportation to reach out to the hospitals to do checkup. So you find out that they will stay at home for 9 months, and when they are in pain before coming to the hospital, and sometimes they encounter problems because they weren't doing any checkup or nothing. So now these challenges have been minimized because we have TTM in the fields that are encouraging these big mothers to visit the hospital often to avoid more problems during labor. We are working with big mothers. We are also working with postpartum women. We are also working with teenagers, explaining, giving out sex knowledge, discussing in depth for teenagers to avoid early pregnancy, and also carrying out awareness for women to understand why they should visit the facilities often for checkups. We want to see women in my Gibi County, basically Kakata, Gibi district, the full health districts, women living in the labor room with smiles on their faces, with their babies healthy and in their sound mind. We want to see girls encouraging others to avoid teenage pregnancy by using contraceptive methods, And we also want to see women encouraging other younger ladies in the neighborhood to visit the hospitals often to get more knowledge on pregnancy, why they are pregnant.
Like many African countries, the fight to save every live birth is important, but the lack of resources in health facilities is a huge setback to ensure reduction in maternal-related deaths.
I'm Nathan S. Tati. I am the county depot assistant for the Magui County Health Team. At the depot, we are responsible to receive drugs and medical supplies from Central. At the time, for now, we are not receiving drugs and medical supplies from Central. That is CMS, Central Medicine Store. What we do here is that CMS bring the drugs from Central directly to the health facility, and we in turn monitor the drugs at the health facility on a quarterly basis, where we go to check how these drugs that have been brought in county have been used by the health facility. Now, this problem is being or everyday issue. It is something that is above the limit of the county health team, simply because it is government that is providing all of the supplies you see at the health facility. So if government bring little supply at the health facility, you find out that sooner or later the facility will be out of stock based on the free services that have been offered by government facilities. Because if you get to any government facilities, you are not paying a cent. Everything there is being done free, and everyone cannot afford the money to go to private facilities. So at the end of the day, the inflow of patients at government facilities is high, and the supplies being sent to government facility is not enough to meet up with the patient need. That's one of the basic needs. And one of the reasons the facilities, they themselves are not buying medicine for themselves. It is government that is bringing the supply to the government facilities. Some of the things I saw in the donations are some of the things that for a long time we stopped seeing at the health facility during our supervision. And another group of NGOs just came somewhere last week. We were on a survey, and we spotted a whole lot of lapses. Facilities being out of stock for more medication like malaria, anti-malaria, reproductive health, and essential drugs and all the rest of it. I mean, it is a great boost to the health facility that have been aided by this organization, because it will help them to really function 100%. Because, like for instance, the vitamin K, the GYN gloves, and other things in the donation are some of the things that are over 2-3 years, or you don't even see at the health facility. And when supply is coming from Central, you don't see them in the supply that the government sent. So it is a boost to those health facilities that really receive the donation today.
The need to provide basic health services in the area of maternal health still remains a challenge, with the lack of drugs and logistics, and most often hard to reach health facilities. And Help a Mother and Newborn is never giving up towards the fight to save every live birth.